Okay, again, good afternoon, everyone. This is Nirav Shah, the Director of the Maine CDC. Thank you all for joining today's media update and briefing. Just a few notes at the very top. We of course intend to continue providing timely information as we are made aware of it. Today's briefing, of course, is in a slightly different format, and I just want to acknowledge that the format of these briefings going forward may change as well. That is being done in the interest of safety and in order to be compliant with Governor Mills's requirements and recommendations around social distancing. So there is more to come on the format of future briefings. We are going to continue balancing the need to furnish information as well as the need for all of us to take care. So again, more information coming on that, certainly, and you'll hear from Robert Long as more is made available. The second thing I wanted to do is to acknowledge that our interpreter, Dr. Thibodeau, is not able to join us because of the fact that this is a telephonic briefing. In order to ensure that the messages and the information today's call are made available as widely as possible, today's call is being recorded. It is being recorded in order to ask that it can be translated or interpreted by an American Sign Language interpreter and posted in an appropriate fashion. So again, as many people as possible can be up to speed on the data. So again, today's briefing is being recorded, and we are doing so in order to furnish that recording to an interpreter for proper interpretation and posting. So with that, I'd like to go ahead and start with the latest updates. As of right now, Maine CDC is recording 89 total cases of COVID-19 across the state. There are in total 8 individuals who are hospitalized across the state. The bulk of cases continue to be in Cumberland County, where we are seeing evidence of community transmission, as we've talked about. Of note, there are 3 cases in Sagadahoc County as well. As we've discussed on these briefings and in these meetings, we do anticipate there being further cases of COVID-19 across the state into new counties, as well as increasing rates of cases in existing counties. As we detect those, we will certainly keep our website updated, but our expectation right now, and consistent with the pattern that we've seen in other parts of the country and in the Northeast, is that we anticipate there being additional cases. I'd also like to provide an update on where we are with respect to protective equipment. Again, this protective equipment is worn by healthcare workers and first responders across the state in order to keep them safe and to keep that aspect of our workforce healthy. We have been carefully trying to balance the distribution of this precious resource in a fair and equitable manner. Tomorrow, Maine CDC will be distributing approximately 22,000 pieces of protective equipment to healthcare institutions across the state. This includes, among other things, approximately 2,400 N95 masks, over 8,000 procedure or surgical masks, almost 2,000 face shields, and approximately 6,000 gloves, among other things. And those will be being distributed tomorrow. I'm also able to report that, as many of you are aware, Governor Mills last week, as well as our congressional delegation, sent letters to officials in Washington, D.C., emphasizing the need for additional protective equipment to be distributed. Governor Mills also noted the need for additional testing supplies as well. We've been recently informed that FEMA will be issuing a distribution to the state of Maine for additional protective equipment. I'll have additional facts of what that distribution looks like once we get confirmation from FEMA about what will be in that cache and when they anticipate it being delivered. I'd also like to note one thing that's been raised. which is at what point folks should start taking necessary precautions. We've heard individuals raise questions about whether they ought to be starting to prepare even if there are not yet any cases of COVID-19 in their county. And my message there is one that I just want to be really straight about, which is that even if you happen to be in a part of the state right now that does not yet have any cases of COVID-19, the first is that what we know about outbreaks is that we are often just detecting the tip of the iceberg. And so there may already be cases. The second thing is that even if there are not, now is the time to begin preparing. And so I would urge everyone, even if you happen to be in a part of the state that doesn't yet have any recorded cases, not to wait until that time. Now is the time to begin preparing for any potential cases of COVID-19, given that we do expect there to be more cases, both in number as well as in geography. So with that, I'm going to turn things over to Robert Long. I believe Robert has a list of the colleagues who are on the phone. And so in order to try to move through, I think Robert's going to try to moderate from the discussion from here on out. So Robert, please go ahead.
Yeah, if everybody could please mute your phones, I will call you out at the and please ask your question. I'll call the next person in line after Dr. Shah has answered. The first person to ask a question would be Patty White from Maine Public.
Hi, thanks so much. Dr. Shah, this is a big spike in cases. What do the numbers tell you about the coronavirus in Maine? I mean, is this giving us any more clues or insights into this situation?
You know, Patty, a couple of days ago, we had a similar discussion when there were not as many cases raised and what type of interpretation we might be able to draw from that. And the same thing is happening right now on the other side, which is we have had a significant increase. There's not really much in terms of what we can say from an epidemiological perspective about a day-to-day shift. In an outbreak situation, we are really looking at trends over a longer-term period, days to weeks rather than hours or days. Weeks to longer periods rather than hours or days. And so a single day, or in this case, 2 days of data, doesn't really give us much insight into where we might be going. But based on what we've seen in other parts of the country, other parts of the region, we do anticipate there being an uptick. And that's, again, all the more reason for folks to really put into place some of the preparation plans and ideas that we've talked about for a while.
Steve Betts from the Courier Papers. Steve, do you have a question?
Yes, I'm sorry, I had it on mute, sorry. Dr. Shah, Knox County has a lot of seasonal residents, and one of the concerns I've heard is that by listing the patients based on their state residence, it may not give an accurate reflection of whether there's the virus here. So is there a way to, one, is that a legitimate concern? And two, is there a way to say we have 5 cases in Knox County, yet they're all from New York, Massachusetts, wherever?
So, Steve, we can look into the latter, but the former point you raise is a really important one. It's closely related to what I mentioned a moment ago, which is no one should be waiting until they see cases in their county or using even a certain number of cases in their county as a calibration point for when to begin taking preparatory actions. The assumption for everyone in the state right now should be that coronavirus and the disease it causes, COVID-19, may be in their communities. And they should start enacting the various measures that Governor Mills and others have noted, such as physical distancing, ensuring adequate stocks of supplies and medication for individuals at high risk, et cetera. We can take a look at the note that you raised, but the real point from a personal protection and preparation is that no one should be waiting until they see cases in their county before they start taking action. The time to be doing that is now, irrespective of what the numbers on the website say. Just to be completely straight about it, the numbers on the website, in a sense, they could provide folks a false sense of security. And that's not where we want to go. I really do want everyone to start taking precautions now and not wait on a certain number to go above a certain threshold on the website. I know that sounds stark, but that's the truth.
Thank you.
Alyssa Thurlow, WABI.
Hi, yeah, Dr. Shah, you kind of just answered my question in that response, but on Friday you mentioned being physically distant. I mean, obviously you're still urging people to stay in touch with their family and friends. What's the best way to do that, obviously, right now?
I can just speak about what and you're correct. I mean, this is a situation where a lot of folks internationally have talked about this as social distancing. Candidly, I think about it somewhat differently. I think about it as social distancing, physical distancing, but social closeness and connectedness. So physical distancing, but social connectedness and closeness. And I think we're about to embark on this experiment in different ways to keep in touch with people. Some of those ways are things that we've done for a long time, like talking to folks on the phone and writing letters. Others might involve something that one of my friends and her family are doing, which are kind of virtual cocktail hours, virtual dinner parties, where folks are connected via their devices in their own homes, but still sharing a meal together and playing a board game together and such things. And so I think there's going to be a lot of innovation that comes into being and shows us ways to connect with one another, even though there's physical distance. In my own household, it's a lot of reading and catching up with one another and talking about our day in a way that we hadn't done so previously. So, again, it's physical distance, but it's that social closeness that's more important than ever.
Bill Trotter, Bangor Daily News.
Hello, Dr. Shah. I'm curious if Maine CDC has seen evidence of community transmission outside of Cumberland County, where the increasing numbers seem to suggest that it is occurring there. And also, I'm curious if you have an explanation for the 8 unknown locations. If you can explain why Maine CDC does not know where those people are located.
Okay, great, Bill. So let me start with the latter. What is meant by unknown is that the case has just been assigned to one of our disease detectives. These cases come into our system in the morning, and the epidemiology team huddles, and they assign each of these cases, each of these people, which is really how I should be referring to them, each of these individuals to a Maine CDC epidemiology investigator. That investigator is tasked with reaching out to that individual to learn everything about them and go through the steps that we've talked about, what the gumshoes do. Sometimes people are able to make contact immediately. Other times it may take a couple of different phone calls. So those individuals who are in the unknown category, it does not mean we don't know where they are. It means that our EPI team has not yet touched base with them. So, and we're reporting it again out of just to be transparent. In terms of your former question about community transmission, at this time, we have only found concrete evidence of community transmission in Cumberland. But this is a good opportunity, once again, to reinforce that we fully anticipate detecting other instances of community transmission across other counties in Maine. That is consistent with what we've seen in other parts of the country as well as in the Northeast.
Okay, thank you.
Jackie Mundry, News Center.
Dr. Shah, some workplaces, people are still going to work and they aren't practicing social distancing. What should employees do, and are there any resources for those employees?
I think the best thing that any employee should do in that situation is to talk to their employer. This is a situation where the governor has asked employers to take this very seriously. And so I don't want to stray too much into that world, try to keep things confined to the health. But as it relates to health issues, I recommend that employees on their own try to introduce that physical distance, and then where possible, talk to their management about the importance of this.
Thank you.
Blair Betts, WGME.
Hi, Dr. Shah. So Cumberland County has the most cases, and I'm just curious, why do you think that is, and what do you have to say to those residents who may not be feeling sick, but they are in an area that has the most cases of this virus?
Great. So there's what we know about infectious diseases is that they tend to propagate and spread where there are more individuals. So as we've seen in other parts of the world and in the United States, the higher population centers tend to have more cases, and that's a consistent finding. So what I would recommend to anybody who lives in or around Cumberland County who may not be, who feels well, but is concerned, would be to, again, really go back to that physical distancing. The way that the virus spreads is that it spreads through individuals who have been in rather close contact within a couple of feet for a sustained amount of time with somebody who has the virus, who's coughing or sneezing. So by introducing that physical distance, even if you live in a high population center like Cumberland County, by really being fastidious about that physical distance, we can reduce the likelihood of the virus transmitting by interrupting its natural flow, going through those air droplets from one person who sneezes to somebody who might be susceptible. So even in high population centers like Cumberland County, that physical distance can really make a big difference. Arguably, it's more important there than anywhere else, but it's still important everywhere else.
Catherine Harrison, Anjambo, Africa.
I wondered if you had any recommendations for immigrant populations who might be without adequate resources to stock up. Particularly interested. Yeah, thank you.
I'm so glad you raised that because early on, anytime we think about a situation like this, like an outbreak situation, we're always thinking about the technical aspects, stuff that we've discussed on these meetings, the number of cases, where are they, where is it transmitting, et cetera. But, and I really do mean this, every one of these cases is a person. And as a result of that, we always try to keep health equity in mind as we're doing some of these rather clinical discussions about numbers. Each of these is a person, and equity matters. And so earlier on in our activation, we began reaching out to folks that we knew from a health equity perspective were folks we wanted to be concerned about. And in particular, that's the group that you raised. Individuals who are recently arrived to our country and to our state. Sometimes they go by the term new Mainers. And not long ago, I had a special meeting with leadership from the new Mainers, from that group, and they comprise various different groups of folks from around the globe who have found their home in Maine. And we talked about a lot of the things that you ask about, which is to say, how can individuals who have underinsurance or uninsurance still make sure they're taking care of themselves? And we gave them tips, for example, on utilizing resources from federally qualified health centers, for example. We went through a lot of different ways that these folks, these immigrants who are new to our state, can make sure that they are being taken care of. Happy to provide you more of what we talked about, but it involved things like touching base with federally qualified health centers when they're not feeling well, making sure that they themselves are practicing some of the social distancing. We talked about ways in which physical distancing may intersect with religious traditions that they may have upcoming. For example, Ramadan and Eid, which are festivals that are coming up, and what recommendations we might have for their places of worship. So we discussed a wide-ranging number of things. I'm looking forward to talking with them soon. That was a long answer, but it's a community that I consider myself to be a part of, and so it's something that's top of mind for me.
Thank you.
Rob Wolf from the Portland Press Herald.
Hi, Dr. Shah. You mentioned that from an epidemiological perspective, you're thinking in terms of analyzing how it's progressing, you're thinking in terms of weeks, not hours or days. So at what point will the Maine CDC be able to tell whether the social distancing measures that people are taking are working?
It's a very good question. And the metaphor I go back to in these situations is that working on outbreaks like this, where you have an incubation period of anywhere from 2 to up to 16 days, 14 days plus 2 days of asymptomatic spread. It's like watching something that you think is a live broadcast, but was actually recorded 2 to 16 days ago, and you may not even be sure exactly when it was recorded. So at a minimum, what we need to do is ensure that we've allowed for at least one full incubation period to pass, starting from the time period when many of the measures were recommended to whenever we're looking at it. So that, again, could be anywhere from 2 to 16 days before we have a sense. But even at that point, when you have a situation where community transmission is very widespread, as it is in some other parts of the United States right now, making determinations about whether something worked or not is, I will be candid, is an epidemiological challenge. Now, what we mean in this situation by saying something worked is that it goes back to that discussion around flattening the curve. But again, that also presupposes that we've got another curve against which to compare it, a counterfactual world in which there was no such physical distancing imposed. And for that, we often go back to historical data from prior outbreaks to try to project what might have happened had we not been there. It's a lot of technical mumbo jumbo. I apologize for that, but I say all that because there are a lot of moving pieces in order to get a sense of where we are at any one time. What we do know is that based on a lot of the historical data managing other similar outbreaks, these physical distancing measures are vital, really absolutely vital. Now, how we assess them in real time, there's a lot of art that goes into that, and again, more than happy to talk about that as data come in.
Samantha Hogan, Pine Tree Watch.
I don't have a question at this time, but thank you.
You're welcome. Steve Bottari, WMTW.
Hi, Dr. Shah. Wondering about the totality of testing. Looking day by day, in particular, looking at the number of negative tests, it seems that the rate of testing, as a total, has slowed somewhat as we got later into the week and heading into the weekend. What is that a function of? Is it a lack of test kits or PPE, or is it simply the quarantining happening? And then the second part of the question is, are we still under testing?
Okay, good. So a few notes about testing. One is that the testing numbers will be updated through the weekend tomorrow. And so as you noted, the numbers that are up are as of Friday. But in addition to all of that, there's been quite a lot from U.S. CDC and others about getting a finer sense of who really needs to be tested. And that information has been pushed out to clinicians. And as a result of that, there's a better understanding of who some of our focus or our groups are. These are individuals that are hospitalized or are healthcare workers and such things. And so as we get a better sense of who really ought to be tested, taking our cues from the U.S. CDC, it's possible that the number of tests that are being done are just being more finely honed into those priority groups that the U.S. CDC and others have identified. Now, whether it could be a function of social distancing as well or physical distancing, consistent with what I mentioned a moment ago, we will, good scientific question, excellent scientific question, and it's one we'll have a better handle on as data come in.
Jim Blykamp, WCME.
Good afternoon, Dr. Shah. I noticed that the recovery number is up from 1 to 3, and I'm just wondering how significant that is to you in the broader context of all the data that you evaluate. And I'm wondering if you expect that number to grow more rapidly, given the fact that on a daily basis more and more information is getting out on all this.
Jim, that is a good question. As you note, there are now 3 individuals across the state who have recovered according to what the U.S. CDC's guidelines are. And that's good news. And as always, one of our top goals is to work with individuals to make sure they've got all the resources they need, healthcare and otherwise, to put them on a path toward recovery. But interpreting these numbers in the same way that interpreting the daily case numbers and any changes in those, interpreting recovery numbers, while it is a positive sign, and it's one that we hope continues, any 1 day or any 2-day set of recovery numbers, it must be interpreted with caution. This recovery rate is consistent with what we've seen, again, in places like Washington, Italy, and the experience in China and South Korea. So the rate of recovery is consistent there. We hope that trend continues. Certainly, if we fall or deviate from that rate in some way, that will be a concern to us. But again, we continue to wish everyone the best on the recovery. We'll continue to post those numbers and continue to hope that the trend is positive.
Stephen Porter, Seacoast Media.
Yeah, thank you. I wanted to follow up on your comments earlier about seasonal residents and visitors. There have been some of our readers down here in York County who have noted a number of Massachusetts and New York license plates in the area, and I was wondering if, in addition to the physical distance that you've been describing, do you have any added guidance for those communities? And is there any discussion of a recommendation to reduce incoming travel from places like New York?
In terms of the additional recommendations, what we know is that the physical distancing is really the key, irrespective of where someone's license plate may be or where they hail from. Given that community transmission, at least as to Cumberland, has been detected and may be soon detected in other parts of the state as more investigations continue, there aren't additional recommendations on top of where we are. In terms of other discussions that have been happening, I know that there are a lot of discussions. I haven't been a part of any discussions of the sort that you mentioned, but as of right now, I think the main theme and the main piece of advice would be to adhere to that sort of those core public health recommendations to try to introduce as much physical distance as possible. And that's really the essence here.
Understood. Thank you.
Lance Tapley?
Yes, thanks. Why isn't still BIW being shut down? The unions have called for it. People have called it a disease factory. You've got a situation where thousands of workers congregate in one small area and then every day spread out to all over the state. I mean, closing it might delay building some warships, but isn't the health of Maine people more important?
Yep, understood. I think I would refer you to the governor's comments there that she made about this last week. Given the unique position that BIW occupies, from a health perspective, I don't have more to add, and in terms of the other dimensions, I would refer you to the governor's comments there.
Colin Ellis, Portland, Phoenix.
Yes, thank you, Dr. Shah. I was just wondering if you could provide any kind of updates on Ocean View and Falmouth, and then maybe any discussions or concerns about similar such communities in the area. There are a number of retirement homes or retirement age communities in that area.
Great. It was Colin, right, from the Phoenix?
Yes.
Okay, Colin, I'm glad you raised that. I want to say one thing. I have been referring to Ocean View as a facility, and then having had the discussions with Ocean View. In fact, I spoke with their director of operations this morning to touch base and see how things are going there and offer any additional assistance that Maine CDC could provide. It's clear to me that they're a community, and that's how I'm going to be thinking about them going forward. At present, there are 6 individuals from the Ocean View community who have confirmed COVID-19 cases. As I mentioned, we are continuing to work with them. I had a call this morning, again, with their Director of Operations or Chief of Operations. If I get her title wrong, I apologize. And I extended our continued support. They have made a request of some types of protective equipment. Their initial request was fulfilled. They, on the call, made an additional request. As I am speaking with you right now, there is a team or someone at our warehouse working right now to fulfill that request for protective equipment to make sure that the community staff are completely well prepared and protected. Communities of that sort across the country have been high concern for public health officials. They continue to be a community that we work with. So to ensure that open line of communication, I've also asked one of my senior deputy to speak with their Director of Operations every single morning to, again, make sure that every resource that they need from Maine CDC, every request they've got is being fulfilled as expeditiously and completely as possible. So we're concerned, but we're optimistic that we can continue to help the folks there and keep everyone safe. So I wanted to do one or two things as we wrap. The first is reference or go back to a quick discussion about protective equipment. So I mentioned we are preparing at the warehouse right now a major order of protective equipment for distribution tomorrow. We are also anticipating additional supplies being delivered from the federal government. But what I think is important there is that what is going to be delivered next is still not yet sufficient. I would again refer everyone to the letter that Governor Mills sent, as well as the delegation, underscoring the need for additional PPE. What we have gotten has been a start, but it is not where we need to be right now. And so we are continuing our call for federal officials to release additional pieces of PPE.